The strike notice is about the Kenya Union of Clinical Officers negotiation stalemate. We, on behalf of the clinical officers working in the national government and the county government, wish to express our discontent with the way the government is mishandling our CBA negotiation proceedings as follows. That the union submitted its draft CBA proposal for negotiation in the last week of November 2017, as agreed upon the return to work formula, which was signed last year, October. The timeline for negotiation agreed upon by the parties then were up to December 31st, 2017, but in any case, not later than 28th February 2018. Due to the fact that negotiations were not completed by the end of January 2018, the union agreed to a further request by the government for an extension of up to 2nd of April. On 10th April this year, the government negotiations team indicated that they will not negotiate on disputed clauses unless the union accept their position, which has resulted into this stalemate. We further observe as follows. The union has always attended all negotiation meetings and ensured quorum in our side. The government team has for almost a half of the time fell short of quorum, which has resulted into postponement of close to a half of all scheduled meetings. The government has also refused to negotiate on disputed clauses for over 4 months into the process now. This shows lack of goodwill from the government to an amicable finalization of the negotiation of our CBA. The national government has refused to sign our recognition agreement as agreed in last year, and this contravene our agreement on our return to work formula. These are delaying tactics employed to frustrate the CBA negotiation process and demoralize clinical officers across the country. Kenya Union of Clinical Officers reiterates its commitment and to amicable completion of the negotiation process without disruption of services, but it is obvious the government is not willing to do so, and they have got no goodwill. Therefore, the union have resolved as follows. The national government and some of the county government that have not signed the recognition agreement to do so as agreed on our return to work formula. The Ministry of Labor, through the Cabinet Secretary, conduct a conciliatory meeting within 28 days, after which, if unresolved, the clinical officers across the country will proceed to have a strike to push and pressure to have their CBA negotiated. Our scheme of service to be finalized within the next 14 days. Honorable members, as we have mentioned, we are trying to say that we have been in the negotiation for the last 4 months of this year to a no resolution. The union has been always in the meeting, and half of all the meetings scheduled, the government never met the quorum. This means that the meeting had to be postponed without an activity. We want to regret this, that the union has been pushed to do what they do not wish to do. We have always said that we need to continue engaging with the government as a partner, not to always push each other in a manner that we have to go on strike. It is only common sense that once you have an agreement, you live to that agreement and ensure that it is implemented. In our return to work formula that was signed last year, we had a very good framework to engage in matters that were affecting clinical officers, understanding that the other health workers were on strike, but we resolved to work and ensure that the health sectors and the services were running despite having other grievances that were not addressed. Those issues still exist in some of the county, which include promotion of our members, which have not happened since we went to devolution. And also, we are saying that we have been pushing that our interns be paid, something that we have also an internship policy that need to be implemented. But the government and the county government have not implemented this. What is these issues that we are talking about? We are pushing on our CBA. We are pushing to ensure that our facilities are fully equipped, that the human resource for health is fully enabled to work, and ensure that even the big four that is being talked by the principle of this country, including the universal health care, is being achieved. We continue talking of understaffing in the health sector. We continue seeing Kenyans dying because of cholera since devolution. For the last 5 years, we have had cholera killing people. And even the other day, you saw a child dying because of cholera. Is it negligence from the government? Is it the reason? Is it because they are quite incompetent to do what they are doing? Or is it because they are neglecting or rather abdicating on their duty? It is the responsibility of the government to ensure that there is affordability, accessibility, and quality health care for all the Kenyans. It is not a favor. It is a must. Now, we have had a song of the universal health coverage. Time call it universal health care. They do not understand that we have a difference between the universal health coverage and the universal health care. These are the matter that we are saying. If you have to achieve it, in our memorandum we are saying you must employ to what we have provided in our standard and norms, that this is the standard provision to have the health workers having. For you to ensure that Kenyatta is decongested, Mama Lucy, Mbagathi, and all the referral facility at the county level, you must ensure that the facility, starting from the dispensary and the health centers, are well equipped and have health workers to work. We have mushrooming facilities, actually buildings without health workers, having a health worker working for 24 hours. How do you expect this person to offer a quality service? This is what we are saying. It is inhuman and we cannot allow it in this era. The bad thing we have in this country, when we talk about health financing, which will enable to ensure that we have a facility equipped and the employment of the clinical officers across the country is up to par, is the people who make decisions on financial health matters and all legal issues. They never seek services in the facility, the public sector. That's what we are talking about. And always the decision they make, they are not informed and hence not meant to benefit even the Kenyan. When we talk about the universal health care, already there is money pumped in. But you'll hear the beneficiary will be in the private. So where does the Kenyan, the Wanjiko, who is a poor Kenyan, go to seek services? They don't get services. Honorable members, the people standing before you, we are not able even to afford the services that we offer ourselves. There is a provision in the Labor Relations Act and also in the Devolved Function Act 2012, which provide that the government will ensure a comprehensive cover for all the health workers and actually all public servants. We have a cover by the NHF, which is not comprehensive, which is the effort of the employee against what the law says. Since when this country will start living to the laws that they provide? We want a comprehensive cover. That's what we are providing on our CBA for our members, because we are not able to afford the services that we offer. This then begs a question: how does other Kenyan afford the services? Actually, I want to say this. How we finance our health sector is a question, and the cost for health services is a question. Now the so said the NHF, which is actually driving the universal health coverage. We know we have issues with the act, the way they are doing their things, the way they actually rebate on services done. We know that all the favor goes to the private sector. We are not saying that the private sector is bad, but do we really rebate for the services or do we rebate for the facility? In any case, if that is the case, this is a government institution that need to support another government institution. And hence, if those issues will not be met as we have said, we have escalated this matter to different government agencies, including the government, the National Assembly, the Senate, and we are planning to meet the Cabinet Secretary. If at all we have to mitigate anything called a strike, and I normally ask, when did the things go wrong? Things start going wrong, things never goes wrong. That is to say, even last year when we went on strike, all the matters that took people to strike have never been addressed. How do we expect the country to run without any disruption of the services that we call essential? The government must give priority indeed to the issues that matter to Kenyans. If not, we will continue seeing these matters coming up all the time, and we will continue running in a country where there is no health care. And I want to note this. From the team that you represent the government, they said last year there was a strike for over 300 years and nothing happened. I want to tell them that Kenyan died, and that is a very bad thing if they still say that people went on strike and nothing happened. The Kenya who died will never wake up. They will never wake up to see into their actually desire to have a better country where health care is never a favor but a priority and actually are guaranteed by the government that is in place.